I'm going to start with a disclaimer.
Yep.
That the act of putting fluoride in the water is called fluoridation with a D. I will 100% say fluorination by the end of the episode.
It's totally fluoridation. I don't even know why that was a thing.
Rolling forward, Dr. Sister Science Facts.
Welcome to the Rolin Forward podcast.
I'm Dr. Alicia Rolin.
I'm Dr. Stephanie Rolin.
I'm a pediatrician.
And I'm a psychiatrist.
We spend part of our time seeing patients, mostly in the emergency department, and part of our time doing research.
I don't even know. So it's true. We're both clinicians in the emergency department, and we have NIH funding to do research. At least as of now, I still do. It's been such a shifting time in healthcare funding that you never know what happens next, but we're going to be here for the ride.
It has been such a shifting time in terms of healthcare in general, and that's why we decided to start this podcast. We don't come from a medical background, and we saw how difficult it was for our friends and our family to understand how changes in legislation are affecting healthcare.
Rolling forward, Dr. Sister Science Facts.
And it feels that way now, that even though we are healthcare providers and we are federally funded to do research, there are changes that are happening so quickly that it can just feel unclear. So we're here to demystify and break things down. Many of you may have heard different conflicting pieces of news about fluoride. So we're going to talk about what is fluoride, the history of putting fluoride in water, when and why people started getting concerned about fluoride, and then some recommendations moving forward. But first, before we get into that, we just wanted to provide a brief update on measles. We have 2 episodes about measles, Measles 101 and Measles 201, and we wanted to give a little bit of an update. Right now, the United States is reporting a total of 712 confirmed cases.
The majority of which are actually children and adolescents, about 70% of cases.
And 97% of cases appear to be in people who are unvaccinated or have unknown vaccination status, which leads into the questions we've gotten, which have been about vaccines. And they've been some good questions.
Since our last episode, we've had some questions come through about measles vaccination and how many vaccines is the right number. Thank you for everyone who emailed us and sent us comments. We just wanted to clarify this. This is super confusing, and the guidelines are constantly changing as we gain more information and we gain more knowledge. And we wanted to provide a little bit of clarification, but knowing that the best next step is always talking to your provider, your pediatrician, about what is right for you and your family.
So in general, if you follow the traditional guidelines, the full vaccines is a 2-vaccine series. You get one around a year old, and then the second one at 4 to 6 years old.
In our episode Measles 201, we actually talked about the ability of getting vaccines early. So if you have a child between 6 and 12 months, you can receive the measles vaccine early. This does not count as part of your vaccine series, and you'll require at least 2 additional vaccinations. So you get one during that 6 to 12 month period, and then you traditionally get another one around 12 months and 4 to 6 years.
That's if you get the first vaccine early. But if you decide to get the second vaccine early, the one that's due between 4 to 6 years, the answer is really we don't quite know. The CDC guidelines now say that that's enough. You can get the second one early, and that's good. But research suggests that some people will get full immunity and others won't.
Some providers are recommending checking that with a blood test to see if you have immunity, but this involves placing an IV catheter, drawing blood, sending expensive testing, and ultimately maybe getting another vaccine. That's costly, and it can involve 2 pokes for kids. And so some other pediatricians are just recommending giving another vaccine because it's safe, it's easy to do, and less pokes for kids.
And it's true that you can check an antibody titer. That's what we call it when you do that blood test. But it seems like they're not fully accurate at determining who does and doesn't have immunity. So at least when it came to our pediatrician, they've recommended getting a 3rd vaccine. So my daughter got her first vaccine when she was a year old. She got her second vaccine around 2 years of age, since we're in the middle of this outbreak. And we decided with our pediatrician that this was best for her. And then our pediatrician has suggested that she'll need a 3rd one between 4 to 6 years. But again, it all kind of depends. And so these are great questions to bring to your pediatrician appointment. Okay.
So let's talk about fluoride. I'm going to start with a disclaimer
Yep.
that the act of putting fluoride in the water is called fluoridation with a D. I will 100% say fluorination by the end of the episode.
It's totally fluoridation. I don't even know why that was a thing. I've worked on projects related to water fluoridation before. When Alicia told me, do you know it's fluoridation, not fluorination? I was like, yes, Alicia.
But it's chlorination.
Totally different. It's fluoride. It's chlorine.
You make a really good point.
So we've been talking a lot about fluoride because it's been in the news and it's just hard to get away from right now.
Robert F. Kennedy Jr. yesterday says he plans to direct the CDC to stop recommending the use of fluoride in drinking water, adding he's assembling a task force to focus on that issue. Kennedy has called fluoride a dangerous neurotoxin and said it's been associated with arthritis, bone breaks, and thyroid disease.
On Monday, Kennedy praised Utah for becoming the first state to ban fluoride in the water supply and said he hopes other states follow suit.
So following our episode about measles, where RFK has made a number of remarks, RFK Jr. has also made a number of remarks about fluoride.
What has he said about fluoride? What hasn't he said about fluoride?
Over the past few months, he has called fluoride an industrial waste. He blames a lot of health issues on fluoride in the water, including arthritis, fractures, cancers, IQ loss, lots of neurodevelopmental disorders, thyroid disease. He says it's killing people.
I think fluoride is a poison and it causes cancers. Of course, it causes your bones to deteriorate and it causes severe IQ loss.
I mean, okay.
And the reason why we're talking about this specifically today is that this week he recommended that the Department of Health and Human Services stop recommended fluoridation of water. This announcement led to the Department of Health and Human Services to convene a board of experts to review the federal government's recommendations on fluoridation of water. The Environmental Protection Agency also is now launching a review of the science of fluoride's health effects. And at the same time, kind of coexciting in this time period, Utah has become the first state to announce a statewide ban on water fluoridation, and that's supposed to go into effect in May.
This is a lot to take in, but why don't we just start with what is fluoride?
So fluoride is a naturally occurring mineral that plays a crucial role in preventing tooth decay. It strengthens tooth enamel and makes it more resistant from attacks from bacteria that cause cavities.
When did they start fluoridating? Look at me. When did they start fluoridating water?
The first city in the United States to add fluoride to the water was Grand Rapids, Michigan.
Really? Michigan?
In Michigan.
That's very interesting.
It started in January 1945, and it was the first city in the world to do so.
Wow. So this has been going on for 80 years?
You do quicker math than I do.
And my understanding is that the American Dental Association has called fluoridation of community water as the single most effective policy to prevent tooth decay.
It has been so effective. It's estimated that fluoride in the water has decreased cavities, poor dentition, tooth decay by 25% in the United States.
That's amazing because 25% reduction in need for dental services works really, really well for me.
Especially when dental services are so expensive. If anyone has gone to the dentist, you learn that dental insurance is a scam. We should not say that.
Dental insurance doesn't cover what you need. At least my dental insurance doesn't cover what I need.
If anybody has ever required dental work for cavities, tooth decays, enamel problems, you know how expensive it can be, even if you have dental insurance.
So if we've been doing this for 80 years, what's the problem now?
So questions about fluoridated water really began, to my understanding, after the U.S. National Toxicology Program started researching fluoride in the water, and they released a report saying that exposures to high level of fluoride could maybe possibly reduce IQ points in children. That is concerning, and that's definitely a finding worth taking seriously. But you have to take that finding into context.
So this is levels of fluoride that are much higher than what's recommended and that it's associated with harms like a reduction in IQ by 1 to 2 points.
The effect size is really small. So these studies are showing a 1 to 2 point decrease in IQ. It is not a massive change of IQ score.
Yeah, that's like represents 1%-ish decline.
Yeah, less than that.
And it's interesting because they're talking about studies where children are exposed to higher than recommended levels of fluoride in the water. And we've known for a long time that high levels of fluoride in anything aren't good for you. I worked in Alaska on a project related to fluoride about 15 years ago. And one of the things that's interesting about Alaska is that there's a lot of people who live in remote regions of Alaska where you don't just turn on a tap and get water in the same way. And so small communities are running their own water systems. And in some villages, they were adding fluoride to the water. And back in 1992, there was a mistake made in how fluoride was put into the water. And there was a dangerous, toxic level of fluoride put into the water.
To be clear, significantly above the level that is recommended currently by the EPA.
So it's estimated that the fluoride levels were 40 times higher than they were supposed to be. And as a result, a number of people became ill. Acutely ill. Almost 300 people were poisoned by this, and one person did die. And so we have known for a long time that having very high exposure to fluoride is not recommended. But that's so different than what we're talking about when we're talking about water fluoridation, because we're talking about tightly regulating how much fluoride is added to the water in a very safe way.
To put in perspective, the EPA's maximum level of fluoride in the water is 4 milligrams per liter. What was estimated in Alaska during this time was over 150 milligrams per liter.
So just so much more. And we know that so much more, even of a good thing, can be harmful. And so maybe you've had one ice cream and it was amazing, but if you had 300 ice creams, you may vomit. And that doesn't mean that the one ice cream is bad for you. But we're talking about fluoride at levels that are known to be toxic.
We also know that is true about things that are essential for the body. Last week, we talked about vitamin A. You will die if you don't have any vitamin A in your body. You will also die if you have too much vitamin A in your body. This is true for oxygen. This is true for nitrogen. This is true for almost every element in our body.
So with fluoride, just like with oxygen, you want it within a range that is safe, and too little and too much is not great. So one of the things that's concerning about this discussion right now is that health officials are taking a study in which children were exposed to higher than recommended levels of fluoride, and they had a very small decrease in IQ points of 1 to 2%, and using that to suggest that any fluoride at any level is unsafe.
What's particularly interesting is that the children that were exposed to higher level of fluoride, it's not that there were errors in the public water system. It's that they live in regions that have naturally elevated levels of fluoride. And there are places in the United States where there's just naturally occurring fluoride that's higher than what the EPA recommends.
And to tackle that seems like it would be completely appropriate. So if the focus right now was on reducing fluoride levels in communities where there are naturally higher levels, higher than recommendation, and these are places in Tennessee, California, South Carolina, Texas, places that we know have high levels of fluoride that are naturally occurring, that would be a conversation to have. But instead, we're talking about removing it from communities that have safe levels of fluoride.
And there's no discussion about removing it in these naturally high occurring regions, at least no discussions that I know of or that I've heard of or that RFK Jr. has publicly announced. And these places that have naturally high occurring levels of fluoride do not add fluoride to their water. And so banning adding fluoride in their water is not going to make a difference.
And at the same time, we're not talking about other concerning toxins that we know are in water. And the one that I always think about is lead.
If you haven't heard about the Flint, Michigan water crisis, it's worth looking up.
So lead exposure for children is neurotoxic at any level. That lead exposure is very, very bad for developing kids. And there are communities like Flint, Michigan, where there is lead in the water and children lack access to safe water. And that is a public health crisis and emergency. We should be getting lead out of water.
We should be getting toxins out of water in general, things that we know are bad for you. Fluoride that we have added in the water is not one of them. The good news is that even if RFK Jr. takes this forward, the federal government decides that they're going to ban supplementation of fluoride in the public water system, it might not have that big of an effect as we once thought. So despite the American Dental Association saying that this was the biggest public health intervention of the last century, it's now in toothpaste. Recent scientific literature has noted that the benefits of water fluoridation after 1975, or the introduction of fluoride into toothpaste, that the effects on tooth decay was more limited. So if we were to stop water fluoridation, it might not be as devastating as it once could have been.
That's right. You can get fluoride from other places. And so what should people be thinking about moving forward? Because what I'm hearing is that fluoride in the water at a safe level is really protective of teeth health. I personally hate the dentist, whether it's for myself or my daughter. And so what should I be thinking of if we're moving forward to a place where there won't be fluoride in the water anymore?
I think the first step is to check if there's fluoride in your city's water system. Fluoride in the water is so variable place to place. Most states don't have a statewide law, and it varies city to city. There's a CDC tool that helps you check your local water supply, and we'll post that link in our show notes. This tool can tell you whether your city fluoridates the water, and if so, how much fluoride is in your water system.
I'm going to use this right now. I'm going to look this up.
DC's not included.
Really?
Some states, there's a number of states that don't participate, and DC and New York don't participate.
Oh, but I think something that you can do in DC is that you can have your water tested. So you can ask the city to send you a little cup and then you can test it for different things. So if you're living in a region that's not on this map, you can see if maybe your local Department of Health or your state Department of Health will test it for you.
If you figure out that your city does not fluoridate water or is talking about ending fluoridation, but you're interested in the benefits of fluoride, you can do a couple things. The first is to make sure that you brush your teeth twice a day with a fluoridated toothpaste.
And it's actually true that since fluoridated toothpaste was introduced in the 1970s, that might be conferring a lot of health benefits that people are also getting from fluoridated water. So it might balance it out if people lose access to fluoridated water.
For kids, especially kids that are not brushing their teeth that well,
You've met my daughter.
you can always talk to your pediatrician about doing a fluoride supplement. Just like we can do vitamin G drops in milk, you can also do fluoride drops. And in some places that might be recommended, or for some patients that might be recommended.
Those sound like some great practical tips that families can use to decide how much fluoride they're currently being exposed to and how much they might need moving forward based on local changes to their water supply.
On the other hand, if your city does fluoridate the water, or if you live in an area that has a naturally high level of fluoride in the water, you can reduce your exposure by changing your source of water, or you can actually add a fluoride filter for your tap, or you can make sure to choose fluoride-free toothpaste.
These all sound like some great tips.
So I think overall, we've shown through research that a low level of fluoride is really good for dental health.
If you are receiving fluoride within that recommended dose, that it is going to protect your teeth from cavities, and who wouldn't want that?
It'll also reduce the need for dental treatments. Now, who doesn't want that?
If you're being exposed to fluoride at higher than recommended levels, the health impacts of that can range from mild, like a 1 to 2 point drop in IQ for kids that are exposed to twice the recommended level, to very severe death if you're exposed to 40 times the recommended level. And so just like with anything, there is a recommended level that you should get fluoride, and that's where you should be.
It's really important to note that all of these studies that are showing harmful effects from fluoride in water have been at much higher levels than what is recommended by the Environmental Protection Agency.
So if you're curious, you can look up your water system or see if you can get your tap water tested locally and let us know what you find.
And for almost everybody in the United States, depending on where you live, keep using your fluoridated toothpaste and keep your teeth nice and strong and healthy and clean.
We want to see those beautiful smiles.
Rolling forward, Dr. Sister Science Facts.
And that's it for our show today. I'm Dr. Alicia Rolin,
I'm Dr. Stephanie Rolin.
and this is Rolling Forward.
You can find us on the socials or send us an email at rolinforward, ROLIN, forwardshow@gmail.com. We love those questions. Thank you very much.
Rolling forward, doctor, sister, science, facts.
Sorry, I'm pulling things up. I have too many tabs open. Too many tabs.